Well, hand washing has been a major focus during the pandemic, and it's working business into a lather for an entrepreneur in Fishers. Project Process has created a portable sink so you can wash your hands anytime, anywhere. But the startup is targeting healthcare. Business of Health reporter Kylie Valletta has more. Kylie.
Thank you, Gary. While healthcare workers wash their hands religiously, it can be difficult for patients too, especially if they're bedridden. Project Process is beta testing its portable sink at Hancock Regional Hospital in Greenfield and is getting a great amount of interest from other health systems as the pandemic highlights the important task of hand washing. Angie Washburn is the founder and chief executive officer of Project Process. She joins me now to tell us about her invention. Angie, thanks for being on the show today.
Thanks for having me.
All right, well, first things first. Everyone's all the rage about hand sanitizers right now, but it's just not as good as a plain old hand washing. So tell us about the problem you saw and how it gave you this idea for a portable sink.
Yes, so it started several years ago as I began to observe patients. I worked in healthcare, so in the hospital and home care, we would see patients who didn't have the ability to use soap and water. And while sanitizer and wipes work sometimes, we know there are situations where soap and water is the only way to wash your hands the best way possible. And so I began to investigate maybe a better way or a systematic way that we could bring soap and water easily to the patient that would help them and also not be a burden on staff.
Okay, so tell us about your sink and how it works. I've seen you refer to it as a sink in a sack.
Right, exactly. We started off thinking it was stack sink or something like that, but it's basically just a simple unit. I've worked with the Purdue Foundry and NMAC, as well as the IoT lab in Fishers, and we just tried to produce the simplest form possible. It's a base, and it holds a sack, and there's a lid that attaches to the top of that. You simply pour the water into the lid and it showers into the sack, and as you enter your hands into both sides of that sack, you're holding a dry sheet of soap, and you're able to use soap and water then to wash and rinse your hands, and it's easy and simple.
So you've actually been working on this project about 3 years, but the pandemic has really pushed hand washing to the forefront. So what kind of doors are being opened for you now during COVID-19?
There's been quite a few because, first of all, the media is reminding everyone how important hand washing is. And, like we already mentioned, alcohol sanitizers and wipes, but those don't always take care of hands that are maybe dirty with debris or those kinds of things. And so it's open light to the fact that hand washing is not accessible even when people are traveling or, different situations. It's also brought to light data has really helped us during the pandemic. We've seen a lot more studies around hand washing, especially as kids return to school this fall. There was just a study published yesterday. Students less than half the time wash their hands with soap and water while they're at school. And so I think it's helping to bring light to the problem, and hopefully we can come alongside and help by providing a simple solution.
And I know home health care is another area that you're interested in targeting. So tell us how you're working to connect with home health care, and also what other connections you're looking for right now to really take this to the next level.
Yeah, so you are right. Home health care has the same issues with hand hygiene when it comes to patients as inpatient care and those kinds of things. And it's lack of access. In mobility, you have patients in their home being cared for, but they can't get up and walk to the sink and wash with soap and water. And so right now we are asking any home health agency to come alongside us and let us help you by providing these units to patients so they can wash while they're in a chair or in a bed really simply and easily. The other things that we're looking for, we're we're looking for additional beta testing sites, hospitals that be willing to test units with us, and also provide data or information on their patient hand hygiene protocol. We know that staff, you always hear about staff and their hand hygiene, but we never really hear about patients, and more studies are now being done on patient hands really need to be a focus too. One of our critical needs right now, we really need companies who will be willing to sponsor some of these units so that we can get them distributed, so that we can begin to not only educate people, but provide them a way to live healthier lives.
All right. Well, such a basic idea, Angie, but really needed right now. Thanks for being on the show and telling us about it, and good luck as you move forward.
Thanks for having me.
Absolutely. Gary, back to you.
All right, Kylie, thanks.